Okay, this is our third mini lecture, and it's on the conditions and disorders that are associated with cranial nerves. Okay, so what conditions and disorders affect your cranial nerves? And actually, it's also the other way. When there's something wrong with the cranial nerves, sometimes you'll have conditions. So some conditions or injuries can damage parts of the brain where cranial nerves are located. In some cases, a condition may damage only one cranial nerve. Trauma or surgery could injure or sever a nerve. So let's look at some of the disorders that affect the cranial nerves. So ALS, also known as Lou Gehrig's disease, amyotrophic lateral sclerosis. ALS, also known as Lou Gehrig's disease, is a progressive disorder where nerve cells break down and muscles weaken. Okay. Bell's palsy, sudden muscle weakness and drooping in one half of your face. So Bell's palsy is also something that most people know about, but there's a side thing that goes with that is also affected. It's called myasthenia gravis, and it can affect more than just your face. It can affect your whole body, and sometimes cranial nerves are involved. Hemifacial spasm, involuntary contractions like twitches on one side of your face. Internuclear ophthalmoplegia is a loss of ability to move your eyes in sync when you look to the side. Okay. Ocular motor palsy is damage to your third cranial nerve that causes one of your eyes to stay positioned as though you're looking down and out to the side. Stroke, any interruption of blood supply to your brain because of a blood clot or a ruptured burst blood vessel. Traumatic brain injury, disruption or damage to brain function, often because of a sudden and violent blow to the head. Trigeminal neuralgia, this one is actually based on the actual name of the nerve it impacts. Chronic pain in your fifth cranial nerve, which runs through your cheek. So, common signs and symptoms of cranial nerve disorders. By the way, there's many more disorders that are listed there that are affected by damage to your cranial nerves. Okay. Your cranial nerves affect many functions and sensations. As a result, different cranial nerve disorders have different symptoms. But one of the things that we look for if we are thinking a cranial nerve disorder might affect your balance, any kind of facial expressions, a sense of hearing, sense of smell, affecting your ability to swallow, affecting your ability to taste. So as we know in all the stuff that we've had with COVID, the COVID is not just affecting your sinus area and your lungs, it's also affecting your cranial nerves because it affects your sense of taste, and that's involved in a cranial nerve, and your sense of vision. All right, so that's the end of mini lecture 3. So I'm going to send you on over to the assignment on cranial nerves in this same module. All right.